and something that I think we've got to do a lot of thinking about. I think most of you who are watching this program are committed to the issue of justice, economic justice and social justice and racial justice, environmental justice. I think most of you who are part of our movement, all of you who are part of our movement, understand that we live in a nation today which has massive levels of income and wealth inequality, and tens of millions of our people are working at horrifically low wages. You're aware that we have a dysfunctional healthcare system, and some 87 million Americans are uninsured or underinsured. So many of our people can't afford to go to a doctor. You are aware that we have a major housing crisis. And it's not only 500,000 people who are homeless, but all over this country. People are packed into homes, apartments, where there's just not a whole lot of room. They're really crowded. You are aware that many people living in cities where there are food deserts, where people cannot go out and get decent quality food, fresh produce. You are aware that today millions of people have no option but that they have to go to work, because if they don't go to work, they don't have a paycheck. And if they don't have a paycheck, they can't take care of their families. And you are more than aware that we have and are living in a nation where we have widespread systemic racism. Now, you all know that stuff, but what does that have to do with the terrible pandemic, the COVID-19 pandemic that we are living through right this minute? Well, the answer is it has a whole lot to do with this pandemic. It has a whole lot to do with who lives and who dies in this pandemic, who gets sick, who doesn't get sick, who gets treated, who doesn't get treated. And that's what we're going to be discussing tonight. And I'm just delighted that we have an excellent panel with us to discuss that issue. In a few minutes, we will be hearing from Dr. Victoria Dooley, who is a physician, family physician in Detroit, Michigan. We're going to be hearing from Brianna Joy Gray, who is an attorney who has worked on my campaign for the last year. We're going to hear from Dr. Barbara Ramsey, who is a distinguished professor of African American Studies, Gender and Women's Studies, and History at the University of Illinois in Chicago. We're going to hear from Dr. Derek Hamilton, who's a professor of policy, economics, sociology, and African American Studies at Ohio State University. And also tonight, I want to thank Shamir, an indie rock and electro pop singer, for being with us tonight and helping us in the transition, which will go from my remarks to our panel. So let me just briefly, before we get into the discussion, tell you how poverty, how income and wealth inequality, how a dysfunctional healthcare system, how a housing crisis, how people forced to work who have no paid and family leave, how all of this impacts the COVID-19 pandemic that we are experiencing. So this is how it impacts it. In Louisiana, 70% of the people in the state of Louisiana who have died from COVID-19 are African Americans. But African Americans make up only about 1/3 of the population of Louisiana. How does that happen? 70% dying African Americans, but yet only 1/3 of the population. In Milwaukee, Wisconsin, where unbelievably enough there is an election today, that's a whole other story, twice as many black residents have tested positive compared to white residents, while comprising only 27% of the population. In Chicago, Illinois, African Americans make up more than half of all positive coronavirus cases in Chicago, make up 72% of the coronavirus-related deaths, and yet account for only 29% of the population. So how does it happen that in community after community, state after state, what we are seeing, we don't have a whole lot of statistics out yet, because a lot of the deaths and illnesses for the coronavirus are not racially discussed or described. But what we are seeing is the African American community is suffering at a far, far higher rate than the white community. How does this happen? What does it mean? And that's what we're going to discuss tonight. So let me, before we get to our panel, let me welcome Shamir and thank them for their music. And then we are going to get to our panel, and we'll start off with Dr. Victoria Dooley in a few minutes. Thank you all again for being with us tonight.
Hi, this is Shamir, and this is my Bernie 2020 session. I'm super excited to do this. I'm a huge Bernie fan and, love everything he stands for, especially, everything he's done for the LGBT community over the years. And, it would just be lovely to call him my president. And, I'm here to play a few songs for y'all. I know you can't see, but I have my guitar. And the first song that I'm actually going to do is a song that I did for a Bernie Sanders compilation record, which is which you can get at berniesanders.bandcamp.com, and all proceeds go to the Bernie Sanders campaign. And it's a bunch of other great artists who, wrote songs and gave songs for the project. And I'm going to sing the one that I have on the record, which is aptly titled Burn With Me. So for everyone who's feeling the burn, this one's for you. Here's Burn With Me. For you to call me on the phone. Thought you were gone for a few days, but you never came home. I knew it frightened you to know you fell for a heart attack. Don't even think about you these days. Don't want you to come back, except to burn with me in the gasoline I secrete. Ashes to ashes, we all fall down, like how I felt since you left out. And just burn with me till it just us left on the street, and laugh about how we felt life by denying the love that felt so right. We didn't get too far when we hopped in that getaway car. We were almost there, but didn't reach the bar. I know I scared you beyond belief. I know that I can change the things that you believe. So you should burn with me in the gasoline I secrete. Ashes to ashes, we all fall down, like how I felt since you left out. And just burn with me till it just us left on the street. We laugh about how we felt life by denying the love that felt so right.
by the coronavirus. Dr. Dooley, thanks so much for being with us.
Thank you, Senator.
Let me just start off by asking you what's going on in Detroit, and why do you think the African American community is being so hard hit by this crisis?
Well, here in Michigan, about 41% of coronavirus deaths are among African Americans from the data that we do have. And you gave some very shocking statistics about in Louisiana and Chicago, about 70% of the deaths being African American. And as shocking as these statistics are, they are actually pretty predictable if you look at the state of health and health disparities here in the United States. The fact that African Americans make up only about 13% of the population, but we are 40% of the homeless population. So of course, if you don't have a home to live, a shelter to be in for shelter in place, you're going to be disproportionately affected. The fact that African Americans are disproportionately incarcerated is a huge factor, is why it's spreading. And the state of jails and prisons in Detroit, as most jails and prisons across the country, very unsanitary conditions. When you look at the workers who are essential but are underpaid, okay, so we know now that people who work at the grocery stores, people who work at the laundromat, they are essential employees. The pandemic taught us this. But African American women specifically are more likely to make these low wage, minimum wage jobs, and they are not able to stay home and shelter in place. So they're going out and interacting with the public at work. So they're more exposed, more at risk.
All right, I want you to stay on that one for a minute, okay? Could you?
Yes.
I think everybody viewing the program has heard stay at home, right?
Yes.
Stay in your room, go out for a walk in the backyard, but stay at home, don't go to work.
Yes.
Well, that's good advice, but what happens if you're living on $12 an hour and you have a couple of kids?
You have to go to work, or you don't eat, or you don't have a place to live. So it's very tough when a lot of my Black female patients, they work in they're caregivers. They work in nursing homes, and they're making low wages, and they are trying to support themselves and some kids, and maybe even help some family members out on the little income that they're earning. And so not only can they not stay at home, but they're in high risk professions because they're going and taking care of sick and elderly people, which is a very admirable job, but they are underpaid and underappreciated. And we don't have the proper protective equipment that we're supposed to have. We don't have the proper masks and gowns and gloves, not at the hospital, but especially not at nursing homes.
So, and let me ask you this, and that is an enormously important issue that I think a lot of people have not thought about. Stay at home, work on your computer. Well, if you're working in a nursing home, and if you're changing beds, or if you're driving a bus, or you're working on a train, or maybe you're in a grocery store, you know what? You can't quite stay at home, can you? And not only do you have to go to work, many of those jobs bring you into contact with other people. Some of those people may be sick.
And not only that, but in the African American community, we have a higher incidence of obesity. We have the highest prevalence of hypertension in the world. Why, we don't know. We think it's some genetic predisposition, but I have to ask, what came first, the genetic predisposition of high blood pressure, or the systemic and institutional racism that created high blood pressure in us? So we're more likely to have high blood pressure. We're more likely to have obesity. We're more likely to have heart disease. African American women, 50% of African American women have some form of heart disease, whether it be related to high blood pressure or some other illness. So not only can we not stay at home, but we have more chronic health problems that put us at risk of dying for coronavirus.
Now, I know the answer to this, but let me ask you a dumb buddy question, because there may be somebody out there who doesn't know that. So what if I have diabetes? So what if I have high blood pressure? How does that impact the likelihood that I will come down with the virus and die?
Absolutely. So diabetes, heart disease, some of these health problems, they weaken your immune system. And not only that, but if you have diabetes and high blood pressure and you're overweight, oftentimes you have sleep apnea. Sleep apnea is a condition that can put a strain on your lungs. My brother, and he doesn't mind me sharing, he beat coronavirus, but my brother, he was a principal in Detroit. He had diabetes, he had high blood pressure, he had sleep apnea. So if anybody was going to get coronavirus in my family, I figured it might be my brother. Fortunately, he made a full recovery. He did not need to be intubated, but he needed to be hospitalized. And he's home and he's 30 pounds lighter because he didn't eat for a week. So he says it was almost worth getting corona because of that.
I don't think he means that.
He does. He was just joking. But yeah, he had
not the best way to lose weight, I guess, right?
Not the best way to lose weight. But when you have those chronic health conditions, it weakens your immune system. And what we do know is when you have 3 or more chronic health conditions, you're more likely to die from COVID. And if you have high blood pressure and diabetes, you probably have sleep apnea or high cholesterol or something else, or heart disease. Those illnesses go hand in hand. And the more chronic illnesses you have, the more likely you are to die from COVID.
Okay, so you started off your remarks by saying these statistics were shocking, but not surprising.
No, not surprising. They're predictable.
Predictable.
Yes, and that's why we need people like you, Senator, who are championing livable wages, the minimum of $15 an hour. We need to eliminate homelessness. It needs to be eliminated. We have several billionaires in this country who would write a check and eliminate homelessness. We need to do that. Everybody deserves a job if they want a job. We need a federal jobs guarantee.
So in other words, all the issues that we have been talking about turns out directly related to this issue of who's living and dying.
101%. And we need to ban fracking, which you have called for, because fracking...
That's another issue. I'm going to get back to that one too, because they're environmental.
Yeah.
I mean, it's an interesting study. I don't know if you saw that. It was based on one study, but it suggested that if you live in a community where there's a whole lot of air pollution, interestingly enough, you're more likely to come down with the coronavirus.
Absolutely. We need a Green New Deal. And a lot of people of color who don't live in fancy suburbs with lots of parks, it might not be safe in Detroit. It might not be safe for you to go out and walk. If there's abandoned buildings on every corner, I have a lot of the patients who were victims of rape in the city of Detroit. They were pulled in some abandoned home and raped. If you can't get out and exercise because you don't live in a safe neighborhood, then of course you're going to get deconditioned and your lungs aren't going to be as healthy and strong as somebody else.
All right. Fantastic. Thank you very much. Stay there. Don't go away. We're going to get back to you. Brianna Joy Gray is an attorney who has written over the years many, many wonderful articles for various publications. Brianna, thanks so much for being with us.
Of course.
I know that you have been studying this issue. All right. And why don't you pick up from where Dr. Dooley left off? Why is it that the African-American community is being hit so hard by this virus?
I think the really crucial point to remember here is that so often, unfortunately, African Americans are a canary in the coal mine. They are the communities which are first affected by a lot of the bad things that happen in this country, and they're the community that is among the worst affected when horrible things like coronavirus hit this country. And as Dr. Dooley so eloquently put it, or eloquently explained, it's largely because the conditions that cause these kinds of crises to grow are already existent in the Black American community to a greater degree. So when you're talking, there was a mention of what's going on in Milwaukee. Well, Milwaukee County is 27% Black, but Milwaukee City is 40% Black. So we're looking at a city that's majority minority, where twice as many African Americans have coronavirus as compared to their white counterparts. And so you ask the question, why is that? Well, Dr. Dooley walked through a lot of the comorbidities, the diseases that African Americans tend to suffer from disproportionately that cause you to be more likely to die if you do contract COVID-19. But another factor is that early on, especially, one of the ways that you could actually be tested by COVID-19 was if you answer the question, hey, have you traveled abroad? And more likely than not, if you were from a lower income community, it's not so likely that you're going to have just returned from your trip in the Riviera or what have you. And so what doctors were seeing is that the patients that tended to get the test to even be able to find out if they had the virus and therefore needed to self-isolate tended to be more affluent, tended to be whiter. So you see those kinds of effects spiraling through on top of the points of care discrimination because we need more Black doctors and nurses, on top of the fact that we are underinsured, et cetera.
Brianna, say a word. This is something I learned about maybe a year ago. and I had a bunch of students from Howard University in the office. And they were saying to me, I hadn't realized this, didn't know it, that when African Americans go to white doctors, sometimes their pain and their realities are not fully appreciated. All right, can you say a word on that, or?
Yeah, studies have shown that white doctors and sometimes Black doctors as well, because when you have these kind of systemic biases, we're not immune to having biases against members of our own communities, right? Will judge the pain of Black patients as lower, and in fact prescribe them lower amounts of pain medication, or not prescribe the pain medication at all as compared to white patients. And actually, part of why you see the opioid crisis expanding first in the white community is partly because of that effect, right? So what this perversely positive effect of the opioid crisis being delayed in the Black community is because Black patients simply weren't being prescribed opioids even when they actually needed them.
That's that's interesting, to say the least. Okay.
Yeah. So when you look particularly like at a place like Milwaukee and Wisconsin, what you're seeing there is a community that has been particularly hard hit by economic factors over time as well. So we frequently hear politicians talking about working class, hardworking Americans, and they often exclude the fact that Black Americans comprise a huge number of the working class jobs that were demolished by bad trade agreements in the industrial Midwest. So that about 50% of African American men worked in those jobs through the 70s and 80s, and they were the ones that were hit so hard by trade agreements like NAFTA, et cetera. And so you see a population that was already disproportionately underemployed and unemployed. Now you see unemployment rates skyrocketing as a result of coronavirus, the fact that Black Americans are disproportionately in low-wage jobs where we're forced to, or often the first to let go. You see a lot of these fast food restaurants, et cetera, being let go.
Hey,
so
well,
you start to, yeah.
What about simple issue of healthcare? If I'm Black and poor, what kind of access do I have in Detroit or in Chicago or Milwaukee or anyplace else to the quality healthcare that I need?
Well, this again is related to this quality of job issue, right? So as Dr. Dooley pointed out, if you're working a minimum wage job, you're less likely to have paid sick leave. You're more likely to be working only part-time hours where you're not extended health care in the first instance. And the whole fiction that employer-based healthcare gives you any guarantee that you will be able to keep your doctor if you like them has really been exploded by this crisis, right? Because now we see in just this past week or so, an additional over 6 million Americans thrown off the employment rolls and now scrambling to figure out what to do, finding out firsthand if they didn't already know how expensive COBRA really is, and realizing that they might have to pay even more in terms of out-of-pocket expenses if they do contract corona in one of these first line necessary jobs that so many of people in my own community are working.
Okay. Brianna, thanks very much. Dr. Barbara Ramsey is a distinguished professor of African American Studies, Gender and Women's Studies, and History at the University of Illinois at Chicago. Dr. Ramsey, thanks so much for being with us.
Thank you.
So let me throw out the same question as I did to our two previous panelists. Why is the African American community being hit so hard by this coronavirus?
Well, I think Brianna Gray and Dr. Dooley have touched on some of the key points. I'm in Chicago, and here in Chicago, of course, the numbers are pretty glaring that while African Americans are 30% of the population in the city, between 68 and 70% of the deaths have been African American. I think what it speaks to is that we really can't talk about this pandemic in colorblind terms. I'm glad we're having this conversation. I think it gives us an opportunity to talk very specifically about the coronavirus, but about the larger set of social issues that set the stage for the coronavirus, right? The intimate relationship between race and class in our society, in systems of injustice and inequality. Our dear sister AOC was on Democracy Now! This morning, and she talked about very eloquently how a precondition is poverty. A precondition is racism. So racism and poverty set the stage for what we are now seeing unfold. The pre-existing medical conditions, of course, the disproportionate numbers of Black folks that have diabetes and obesity and heart conditions, and all that make us more susceptible. But also housing, also just having to go to work when you're sick, and all of these things, intimately bound up both racial issues and class issues at the same time. Other thing I wanted to just, speak to on this question that hasn't been discussed thus far is kind of what Black communities are doing in response to the coronavirus pandemic. And I think that's very important, because sometimes in a situation like this, we feel like stuff is happening to us, but what is our agency? One of the things we can do is support progressive political candidates at the presidential level, of course, Senator Sanders, and then others in our communities as well. But there's, the organization that came out of the Black Lives Matter movement is the Movement for Black Lives. And so they've developed a set of demands, and it starts off, and you will find this, resonates with your campaign agenda, Senator Sanders, put people first, which really indicts the ways in which corporations have still, gotten a sweet deal out of the response to this epidemic. Communities are still suffering. People have not been put first. And the people who are most vulnerable in particular, which is Black and Brown communities, have not been put first. It shines a spotlight on the question of those who are incarcerated, in detention. We had a big demonstration here in Chicago today that is a demonstration for the moment, which is to say people in cars and standing 6 feet apart circled the Cook County Jail to demand the release of people in jail, overwhelmingly Black and Brown people who cannot practice social distancing, who are being made very, very vulnerable. And these are, people who haven't been convicted of something, right? People who can't post bond, people who are waiting for their hearings, or who have technical parole violations and so forth. So all of this is in the mix when we look at the impact on African-American communities. And I think in a real fundamental sense, going back to the Katrina disaster in New Orleans, going back to the 2008 financial crisis, everything we are before the crisis as a society, as a community, as people, that's how we show up in the crisis. So we are a fundamentally unequal society. We are a society steeped in racism and white supremacy. And all of this manifests in the moment of a crisis. And the real question is, kind of what do we do? Do we turn ourselves over to the people who say they know what's best for us and who may have, and in fact, I think do have in many cases a different agenda? Or do we look at this as an opportunity to really rethink, right, what we're doing as a society, what our policies reflect?
And that is exactly right, Mark. I kind of think if there's any silver lining in this horrible, horrible disaster that we're going through, it is maybe the time to think about how we got to where we are. We're talking about
absolutely,
and where we want to go in the future.
Absolutely. I mean, you think of even crises in our own lives, right? We have a crisis in our life and we think, okay, how do I want to spend the rest of my life? What do I want to do with my life? We can do that as a society too. Good. This is hopefully a pivot.
That's right. Okay, good. Thank you so much. We'll get back to you in a second. Let me get to Dr. Derek Hamilton. Dr. Hamilton is a professor of policy, economics, sociology, and African-American studies at Ohio State University. Dr. Hamilton, thanks so much for being with us tonight.
Thank you, Senator. Always happy to be on with you.
All right, let me throw out the question and take it wherever you want it, where you want to take it. Same question. Why is it that the African-American community is being hit so hard by this coronavirus pandemic?
Well, it is evident that it's not happenstance that the Black community is hit harder than other communities. I mean, collectively, we made the moral and just decision to halt the economy in order to save lives. Nonetheless, Black people a priori have low wealth, they have inadequate health insurance coverage, and they have occupations that are more precarious. They work in jobs that are more precarious with regards to work conditions, worker protections, wages, and various other things that relate to a good job. They have extended family networks that they have to care for because of larger networks of poverty, as well as intergenerational aspects of transfers of both poverty and affluence. And then we have environmental degradation that hits certain communities worse than others. So we again, as I point out, it's not happenstance that if we have a community that is asked to stay at home, that one, they don't have the income to support themselves, nor do they have the flexibility of a job that would permit them to be at home. So that's not happenstance. Now, the good news is that you pointed out silver linings. And actually, I shouldn't say good news. I should say that the COVID-19 pandemic is revealing our collective vulnerability in the sense that prime ministers, royalty, are literally at risk for dying mortality from COVID-19. But hidden in plain sight are the everyday vulnerabilities that various people have and live with because of their economic as well as physical conditions that they live in terms of housing, environment, et cetera. So we can do something about this. That's the other point. The other point is that if inequality and despair, those are political choices. You have put forth an anti-racist economic bill of rights. And why do I say anti-racist? Because the bills that you're putting forth recognize that what we did in the past, going back to the New Deal, excluded certain people, and it was by design and implementation that those people were excluded. For example, excluding domestic and agricultural workers from labor bargaining, from Social Security, that was a political choice. Likewise, today, we can have a political choice with agendas that you put forth, such as Medicare for all, where we're not rationing healthcare based on one's ability to pay at their most vulnerable position. Right when they're sick, we shouldn't be worried about whether you can pay and ration out.
All right, let me stay on that one for a moment, Dr. Hamilton. What would Medicare for all mean for the community, for the American people in general, for the Black community in particular, right now in the coronavirus pandemic? What would that mean if everybody on healthcare is a right, if the function of our healthcare system was not to make money for the insurance companies and the drug companies, but to provide the best quality care for all of our people? How would that impact the Black community right now?
Yeah, and I'm going to speak about Medicare for all, but let me also point out that the whole package that you put forth has similar elements to what it is I'm about to describe. We are saying that one, everyone will have access, period. And then everyone will have adequate quantity and adequate quality. So you're putting forth policies, in my view, that provide adequate quantity, quality, and access to something that's so essential for people to have agency in their life, which is the ability to see a doctor when they're sick. So regardless of race, class, gender, et cetera, everybody would be covered under a plan.
Let me throw this out to you. Ready? Here's the question. You ready?
Ready.
Now, this must be an incredibly radical idea, right? You probably thought of it last night, the middle of the night. You said healthcare is a human right.
You know what's radical? What is radical is believing that the market is the solution for all our problems, regardless of what it is. That's radical. To not recognize that the public sector has a great deal of power and the fiduciary.
Wait a minute. I have been told, my God, on debate stage all over this country, that people love their private health insurance. Oh my word. And isn't it great that you have a job and you got your private health insurance with that job? You think maybe just now in the midst of this terrible economic meltdown, some people might be rethinking out what's going on now in terms of people, we're talking about people losing their jobs. What else are they losing?
Right, and what you pointed out is a conservative talking point, because you're not telling people they wouldn't keep their doctors. No, people don't love their health insurance company, they love their doctors. And so those are conservative talking points. But, the other point that we should also make sure we mention is that in this package, you talking about a Green New Deal, a federal job guarantee, you're literally saying that the threat of unemployment should be removed, that the federal government has a responsibility to ensure that everybody has a job with adequate wages, adequate benefits. And what it also does is it allows us to build our public physical and human infrastructure. If we had a federal job guarantee in place, or Green New Deal in place right now, we would have had more nimble workforces. We'd be able to redirect resources to where they're most needed. And we even have the flexibility to provide for people to be able to work at home so that they can have social distancing. And then I'll say one last point. I know I talk a lot, but one last point is that our tax code should have the values of economic inclusion, civic engagement, and social equity. The most powerful fiscal tool that the government has, the tax code, should be one where we promote shared prosperity. So you are right, we should tax wealth. You are right that we should have a more redistributive tax code. And one thing that's being set up as precedent from this COVID-19 pandemic is that the federal government can intervene to guarantee income. We're sending checks out right now. So when there isn't a national crisis, if somebody has inadequate income, we can put that in the tax code as well.
Good. All right, let me get back to Dr. Ransby. You talked about, maybe it's a moment to do some rethinking. All right, pick up from Dr. Hamilton. What should we be rethinking? What kind of world should we be looking at so that not only are we better prepared for a terrible pandemic, but to create a better life for all of our people?
Yeah, well, that's always such a beautiful question, because those of us who, have been in the struggle for freedom on various fronts for so many years, I mean, we're often clear about what we're against because we feel besieged by so many things. And there's so many bad things to worry about that sometimes we don't indulge in thinking about what are we for? Like, what would it mean to have universal health care at this moment? I think people are also afraid of getting sick. I mean, afraid of getting sick, not just for their physical well-being, but afraid that they're going to get sacked with a medical bill, afraid that they, will be forced to work anyway if they go to and so forth. So, when I think of what are the possibilities now, I'm just, I'm pretty amazed certain crises get attention and seem to matter and galvanize public attention in ways that others don't. I mean, for many poor Black people have been in crisis, right? There have been a lot of crises, a lot of precarity, a lot of sort of living on the edge, living paycheck to paycheck, and also dealing with issues of racial profiling, dealing with the prison industrial complex. I mean, all of these besiege our lives in really important ways. So when we imagine...
Let me jump in and ask you this. I want to pick up from...
Yeah, I want to get to my freedom dreams, though.
I want to get that to Dr. Dooley in a second, but are these, Dr. Hamilton was talking about the right to a job. Given the enormous amount of work to be done in this society, I'm not just talking about the infrastructure, I'm not even talking about climate change and transforming our energy system. We could be talking about childcare, putting people to work. In Detroit, Chicago, we don't have enough, and all over this country, we don't have the kind of teachers that we need. We have adjunct professors who are living on food stamps, et cetera, et cetera. Talk for a moment. I don't want to get to Dr. Dooley. Talk about the work that needs to be done in America today.
Yeah, I mean, what's often invoked when we talk about the Green New Deal, and I was glad, I'm a historian, so I was very glad to hear Dr. Hamilton, invoke the limitations of the New Deal of the 1930s around issues of race. But one of the exciting moments in the history of this country was imagining all kinds of work. I mean, people who were poets were paid to do creative work, right? We can think of people doing childcare. We can think of people making our parks more beautiful, people doing landscaping. We can think of, people renovating homes that many of our homeless brothers and sisters, could live in. I mean, there's enormous work, public works, education. I teach at a university and for many, many years. And the hierarchy within the university of many of my junior colleagues, adjuncts, temporary instructors live a very, very precarious existence. And they've spent many, many years, developing certain expertise in their fields. And it's really a shame. Our public school teachers, I love the Chicago Teachers Union because they fight really hard for students and for working people. But teachers are not paid what they deserve. And we need more teachers. So I mean, all of these are areas of work.
If I can jump in, I mean, when we talk about a new America, and we learned something from this crisis. You know, I can't remember who it was, Brianna or somebody earlier, about essential work. Wow. Turns out the Wall Street stockbrokers are not necessarily essential, but the clerk in the grocery store, the person at the pharmacy, the bus driver turns out to be pretty essential. Teachers turn out to be pretty essential. Maybe this is a time to rethink about what's essential, what our priorities are, what is really important in our country.
Sanitation workers, mail carriers.
That's right. That's right. All right, let me get to Dr. Dooley and throw out an easy question. I know that you've been fighting for this for years. What does Medicare for All mean for your patients?
Medicare for All is going to be huge for my patients. Let me first address it. Some people will say, well, Medicare for All won't cure racism. They kind of like throw that out there as a reason not to fight for it. And to me, it's such a silly thing to say. Freeing the slaves didn't cure racism, but that doesn't mean that we shouldn't have done it, right? So before the doctor can discriminate against you, you have to have the means to get to the doctor, okay? So let's work at step one. Let's make it so that everybody can get to the doctor, okay? And then what I'm so excited about your bill, because you wrote the damn bill, is that in your bill, you make it illegal for providers to discriminate against people because of race or gender, ethnicity, etc. And that's important. All these racial biases that we learned in medical school, we need to make medical schools accountable to train clinicians in providing culturally competent care. That is crucial. So no, Medicare for All won't eliminate racism, but it'll give you the entry to the doctor. And then if a doctor doesn't listen to you, you'll be able to go get a second opinion. I have patients who went somewhere and they didn't feel like they were heard, listened to, but they already spent all their money on that one visit. They don't have any more money to get a second opinion. So with Medicare for All, eliminating these financial obstacles is going to be huge for people of color. It's this really funny thing that insurance companies will grade doctors based on how good of control their people living with diabetes have, okay? So if the people living with diabetes who are my patients, their diabetes is under good control, they say I'm a bad doctor, right? But my patients living with diabetes, whose diabetes is not controlled, I know why it's not under control, because they cannot afford their insulin. So instead of the insurance company...
Let me interrupt you there, okay? Because, you know, I don't know, last year I took a trip from actually Detroit to Ontario.
Yeah.
Where we learned that the cost of insulin was 1/10 the price. There is a massive amount, I don't want to spend a lot of time on this, but unbelievable, some of the viewers may not know this. A lot of people in America, I think this is what you're talking about, are rationing their insulin. Is that true?
101% true.
And what does that mean? If I have diabetes and I'm rationing my insulin, what does that do to my health?
You could die at the end of the day. I've had many patients come in. There's a number where your diabetes is supposed to be under control, and that number is supposed to be in the single digits. And when they're rationing their insulin or they're not taking it, they come back and see me, it's in the double digits. Sometimes they can be hospitalized, almost in a coma. And so the way to get people living with diabetes, their diabetes under better control, is to make their insulin free. But they want to say, I'm a bad doctor because their diabetes isn't in control, but it's not controlled because you as an insurance company won't pay for it. $250 a month for insulin with somebody who's making $10, $12 an hour. It's just not feasible. Medicare for All, free at the point of care, will be life-changing for all of my patients, especially my African-American patients, and will help us to live longer. We're going to work on the racist part, on the implicit bias part. We're going to make sure that providers are held accountable, that they're going to believe Black women when they come in with pain complaints. We're going to make sure that happens. But in order for those women to be believed, they have to have means and the way to get to the doctor.
All right, let me just throw out one more question. I want to go to Brianna then. We don't have enough Black doctors and we don't have enough Black nurses, which takes us then to the cost of college, yes, and to graduate school. Not a whole lot of people can afford the cost of medical school. What would it mean if we made tuition, public colleges and universities tuition free, and we made sure that anybody in America who wanted to go to medical school and who was prepared to practice in an underserved area, how would that impact your community?
Well, something that a lot of people don't know is that Black Americans try to go to college and grad school at higher rates than almost anybody else in this country. But the reason our graduation rates are lower than other groups is because we don't matriculate often. And what's a primary reason why we don't end up graduating? Well, it's because of the cost of school. So this is a story that's very near and dear to my own heart because my own mother told me stories of how she went to Howard University, historically Black college in Washington, D.C. My parents met there. And she ended up having to take an extra year to graduate from college because she didn't have $400 that she needed for her bill her junior year and had to sit the year out and work until she could come back, right? So having a free public colleges and universities and doing what you're doing is to say fully funding all HBCUs, whether private or public. So 76% approximately HBCUs are public universities already. But everybody who wants to go to HBCU and everybody who wants to go to a public college should be able to go without incurring hundreds of thousands of dollars.
Let me interrupt you and again ask you a dumb bunny question. I know the answer, but I want you just to stay on the point here. Is what would that mean? We need more Black teachers.
Yes.
We need more Black doctors. We need more Black nurses, etc. What would making public colleges and universities and HBCUs tuition free mean for the Black community in that sense?
So an enormous amount of teaching jobs require you to have an advanced degree, to have a master's at least. So we're asking people to incur literally over $100,000 worth of debt in order to take a job on average that pays $40,000 or $50,000 a year. So people who do this are really heroes. They're people who obviously are deeply invested in the profession because it's basically a life sentence to go and get a graduate degree at this point in time, particularly for African Americans, because we tend not to have the family wealth to help us pay off our debt. So 12 years after graduation, the average African American has more student debt than they did the day they graduate. And
say that again.
most people don't.
Say that slowly and say it again.
Yeah, 12 years after we graduate, we tend to have more debt. The average African American has more debt than they did upon their graduation. Part of that is because we're dealing with interest rates that are around 8%. I know that I'm paying 8% on my loan. So at this point, I've almost paid as much as it took for me to go to law school, right? But because I had something like $18,000 of interest the first year I was paying back my debt, it's very hard to keep up. And I'm one of the lucky ones. Play the world's smallest violin for me. I had a good job as an attorney, et cetera, et cetera. But so many people, especially teachers, aren't in that position. So your plan to make sure that teachers get at least a minimum $60,000 salary, that schools are funded so that teachers aren't having to reach into their own pocketbooks to pay for class materials. This is crucial to making sure that we have more equity, both in education and in healthcare.
Okay, Dr. Hamilton, I want you to kind of maybe put it all together, dot the I's, cross the T's. What you got?
And you know what? We need to think about millennials in this scenario as well. Millennials will have gone through at least two major economic crises. Right. They came into young adulthood right after the last Great Recession, and undoubtedly the economic harm that COVID-19 is going to do is going to lead to more precarious scenarios. But yet we told millennials that their pathway towards success was through education. And we burdened them with record levels of debt. And also what's in there is the race element. So as was just pointed out, Black people 4 years after graduation have on average more than $50,000 in student debt compared to—
Stop you, say it again slowly, because these are really, I think most viewers don't really appreciate how bad the situation is. Say that fact again.
Yeah, 4 years after graduation, the average Black debt is about 4 years for a college graduate. And let me also make the point that that's immoral. It's immoral that we have a lower rate of return to a college degree to a Black person, as well as we saddle them with all this debt, and we tell them that this is the pathway for economic racial equality. Now, I would say that irrespective of the functional role of education, it should be a right that we should guarantee in America because we're wealthy enough and we can afford to provide all our citizens and American people in general the opportunity to have a college degree. That's the right thing to do. So, you know,
I want to interrupt you. I want to get to Dr. Ramsey now because this is getting interesting. Dr. Hamilton talks about rights. Maybe is, all right. What are we entitled to as human rights? What are our human rights in your judgment?
Well, certainly, as an educator, I certainly think education is one. Of course, healthcare is one. Of course, housing is one. But I want to say one more thing about this discussion about education. I mean, I participated in a conference at UCLA recently by these wonderful young people who are organizing to cancel the student debt, right? A debt strike they're talking about. So that I think is absolutely necessary. But we also need to really talk about democratizing education K through 12. When my students come in a first year class, they've already had unequal access to quality education, either overcrowded schools or schools not in their neighborhood or underfunded public schools, crowded classrooms. So all that has to be a piece of the puzzle of making higher education a human right, right? So it's all on a continuum. The other thing I just want to say is just about how we think of the economy. And I'm not an economist, but I read a lot of economists. And I think, at this moment, we see the fault lines and the flaws of what many of us call racial capitalism. The fact that we have hospitals and states and the federal government actually competing to buy ventilators and PPEs. My husband works in a hospital in an ICU actually, and I'm very afraid for him because the equipment is not there. But it's this sort of profit-driven system that makes us all vulnerable and is not providing what some of us might think of as rights. The right to healthcare, the right to protective gear when we go into our workplace and try to serve others, and all of that. So this whole question of race is really important, intimately bound up with the economic inequalities and the sort of logic of the current economic system that we've constructed, or I haven't constructed, but has been constructed and we live under. And we really need to imagine something, a set of policies and practices that are real alternatives to that, and not be afraid of it. And that's one of the things I think that stands in our way of really imagining, making a claim for all the rights that people deserve, from healthcare to education.
Okay. I want to get to questions in a moment. But before I do, anybody want to add anything to this very lively and I think interesting discussion? Dr. Hamilton, I see you.
We all have lots to say.
I'm going to be really brief, which will be surprising, but this is the one time I'm going to act like my brethren and be a traditional economist and say that with regards to racism, not only do we need to have implicit bias training, but we need some teeth attached to it as well. So we need a federal government that prosecutes racism. So when a company is engaged in racist behavior, or when individuals in certain structures are engaged in racist behavior, it's not enough to enlighten them to their behavior. We need to have sanctions and rewards for good behaviors so that we can have the type of society we want with regards to racial inclusion.
Okay, there are a lot of questions that are coming in and I don't have the time to go over them. So I'm just gonna read them as they come in and everybody jump in as you feel. Here's from Zach Handler. He writes, what effect has our system of mass incarceration had on racial disparities in the coronavirus? Do the lingering effects of incarceration and the rights they are denied to former felons have any particular effect now? That's from Zach Handler. Anyone want to take a shot at that?
Well, absolutely. Absolutely. I mean, Michelle Alexander wrote a wonderful book, New Jim Crow, that talked about the whole caste system that's been created as a result of not just mass incarceration, but what Dylan Rodriguez calls targeted incarceration, because it's not just everybody. It's poor people of color. And it's not just all Black people. It's poor and working class Black and Latinx people who are disproportionately in prison. But what that means, most people come out of jails and prisons, and they come back to communities. They come back to communities discriminated against. They come back to communities that have been bereft of their absence. They come back to communities that are wounded by all that has happened to the incarcerated members. And so, that is part of the landscape on which this crisis is occurring. People also are very skeptical of surveillance. And one of the things that, I'm concerned about is the kind of militarization of this crisis. Send in the National Guard. Let's watch everyone. And as we see in places around the world, places where, President Trump has good friends, Duterte in the Philippines or Modi in India. I mean, people are literally being beaten in the street for violating shelter-in-place orders that they are, hard pressed to comply with. So I think, the fear of surveillance, the fear that a certain kind of policing will be used against a community that's already unfairly policed, heavily policed, and victims of police violence. We have a program in Chicago called Eat, Equity, and Transformation, and it's run by formerly incarcerated folks. I have the privilege to serve on their board. We did some fundraising, and when some of the organizers went out to give out, sort of care packages and money to people in the informal economy, he found a number of young Black men standing up against a wall on the west side of Chicago being searched by police who said, they were in violation of, now that's not what the mayor says is supposed to happen, but that is in fact what happens on the street. So all of this, factors in, we are we are in a crisis, what we were before the crisis. And so all of this, sort of comes to bear.
Anyone want to add anything? Because I got a bunch, if not, I got a bunch of questions here. Here's one from, we didn't talk about this, but this is, something that's right out there. From Matthew L. Killen. Question is, how accessible is the internet in Black and brown communities?
Not accessible enough. Not accessible enough. And again, my brother, he was a principal in Detroit, and we have this conundrum where we can't get the kids to school because it's not safe. And so we wanted to give the kids some homeschooling, but there are too many kids who do not have the internet and do not have laptops at home and even a comfortable spot at home. They don't have food so that they can be well nourished to have the brain power that they need. So it is a huge problem, especially in large urban cities like Detroit, and it needs to be solved. And that's why I'm really excited about your high-speed internet for all plan, Senator Sanders. The internet is something that's crucial, is essential for learning for all age groups, and a crisis like this just shows us that everyone deserves access to the internet, everyone.
And we are so far behind so many other countries, and we pay so much for broadband that it's really quite pathetic. Anybody else want to jump in on, it's, here it is. Not everybody, we all think, oh, well, of course we go to our computer. We all have broadband. Guess what? We don't all have broadband, right? Anyone want to add anything?
Yeah, I just wanted to add, my partner's a housing attorney from Detroit, but working in Brooklyn. And one of the things that they've had to deal with now that the courts, they're all issued, stay at home, work from home orders, is that it's difficult to get in contact with some of their clients because a lot of them don't have cell service, or their phone plans are intermittent because of their inability to pay bills. And they used to be able to rely on, I can send this person a letter and I can see them in court. And now just the pure communication of court dates and what their responsibilities are, or dealing with their landlords, et cetera, are complicated by the fact that they just don't have reliable internet opportunities.
Again, we take the middle class, upper middle class takes for granted. Of course, you have access to the internet. Of course, you have a good computer. Of course, you have a cell phone. Guess what? That's pretty expensive. And if you're making $12 an hour, and by the way, you just lost your job, maybe you're not going to have that telephone service. And how would you like not to have telephone service in the midst of this crisis? Anyone want to add anything to that? All right, here we go. Maria Aguilar writes, how badly will this pandemic impact the homeless population? Anyone have any thoughts on that one? Yeah, Dr. Hamilton. Dr. Hamilton, we'll get to Brianna.
I mean, it's evident that they're completely vulnerable in this scenario. I mean, we're telling people to shelter in place. They literally have no place to shelter in without us providing something for them in a public way, which is, again, we were talking about rights. The right to shelter should be part of our public agenda. We need a program that assures people a safe and stable unit in which they can live, period. And we can afford that too.
And our housing, I learned, believe me, in the last year, how severe this housing crisis is from one end of the country to the other in communities where you would not think that was the case.
Yeah.
I think I was in Greenville, South Carolina, and a teacher there says, she doesn't make a whole lot of money, but she makes middle-class salary. Gentrification has raised rents there. She's paying half of her income for housing.
Yeah.
Word on that. Anyone want to add anything to that?
And we know that, I'm sorry.
No, it's okay.
We know it has racial dimensions as well. We certainly know that the homeless population is overwhelmingly Black, especially from a proportional standpoint. We know it also has gender identity effects. We know that for homeless youth, we know that being transgendered is, and especially if you're a Black or Latinx transgender, there's a greater likelihood that you're going to be homeless. So one identity.
If I'm I'm thinking right now that literally less than a mile away from the Capitol, there is a homeless shelter in Washington, D.C. I would be very nervous now, would I not, to be in a homeless shelter tonight? Anyone want to add to that?
Absolutely. Not only, when we use the term homeless, we think of someone living on the street, which of course many people are, but there's also housing insecurity. People who are sleeping on somebody's couch and then their cousin and then, moving around, sometimes with children in tow. Women who've experienced domestic violence are also in this category, but housing insecurity, having to be in cramped, inadequate housing circumstances is another form of, another violation of what should be a human right. So it's those individuals who are on the street who are most vulnerable, and then those folks that just do not have a permanent home, kids who do not have a place where they can do their homework at night, people who don't have, a shower that they can use every day because they simply are living here and there day to day.
I'm just thinking in the midst of all this, some of our billionaire friends are building mansions worth hundreds of millions of dollars.
Multiple mansions.
Yeah. All right, I got another question here. This is a medical question, doctor. You ready? All right, here it comes. This is from Natalie Holy. She writes, question for Dr. Dooley. Me and my cousins all have asthma. Is there anything extra we can do to protect ourselves beyond the usual staying home, plus masks, social distancing? Asthma.
That's an excellent question. Asthma is a huge issue for especially communities of color who have to deal with environmental toxins and cockroaches and mold and dust. And so the best way you can protect yourself is to make sure your asthma is under control as much as it possibly could be. Some people's asthma is so severe that they need a daily inhaler. Please use your daily inhaler. But then we have a problem, Senator Sanders, that a lot of these daily inhalers for people living with asthma are brand name, they're not generic. So their copay for them are extremely high. I don't keep a lot of samples in my office because I don't write a lot of brand name drugs because there's almost always a cheaper alternative. So I don't write them and waste people's money. But I do keep asthma inhaler samples in my office because it's one of those few drugs that are life-saving. But because there are not enough generics, if any, in some of the brands, that people just can't afford them. So if there's any way possible that you're supposed to be on some medications for your asthma, you need to make sure that you're taking them right now. If you don't have the means to afford them, you can contact your doctor, see if they can get you samples. But wear masks when you go out. If you don't have a mask, you can tie a bandana around your mouth. But the best way to keep your asthma under control is to make sure you're taking all the daily medicines that you're supposed to be taking. And if you do have to leave, or if you are around anybody who's sick, to maintain social distancing and wear some type of mask over your mouth.
Let me ask you this question. I think I know the answer. What impact does the high cost of prescription drugs have on your patients?
Oh, it leads to hospitalization. So this is a crazy thing. Private health insurance they don't want to pay for the inhalers for asthma. So what happens? Your asthma gets bad, you end up in the hospital for a few nights. Well, the cost of that hospital stay is more than the cost of the monthly inhaler, but they don't want to pay for the inhaler. So nothing about our current system makes sense. It's cheaper. It costs less for people to be healthy. If you pay for their insulin, if you pay for their inhalers for when they have asthma, they're going to be less likely to end up in the hospital, which comes to tens of thousands or hundreds of thousands of dollars if they get sick. We need to pay for people's prescription medications. We need to pay for them in full. We need to pay.
I think the point that you're making, that prevention is not only more humane, it is so much more cost effective. I mean, you could take it right to the issue of criminal justice, isn't it?
Yes.
It costs more money to lock somebody up than send them to the University of Michigan, I guess.
Yes.
Okay. So we educated our young people, invested in our young people. Not only do we keep people out of misery, but we save money as a society.
Yes, and if we have a new deal to make sure that people live in healthier environments, they're going to get less sick. And if we pay for their preventative medicines, then they are going to use less healthcare because they're able to stay healthier.
I mean, that gets to the root of everything. I mean, I think investing in people, keeping them healthy, keeping them well educated, keeping them housed decently, not only is the human thing to do, it's cost effective, I think.
Yes.
All right, who else? Anyone want to add to that? All right.
Well, it's sad that we think of that as a radical proposition, right? It's so fundamental, so fundamental.
Well, again, getting back to Dr. Ramsey's, statement a few minutes ago, maybe this is the time to rethink those things. Maybe we can't afford to lock up 2 million people anymore. Maybe we should invest in education and jobs. Okay, maybe that makes a lot more sense. All right, here's the last. We got a million questions here, but let me just throw out a last one. This is from Wesley Allen Williams, who writes, is racial disparity in health more of an issue from the healthcare industry, or is it overall a systemic racism issue that is the root of all problems? Is it a healthcare industry problem, or is it systemic racism, I guess is the question.
Can it be both? It doesn't have to be either or, both.
It is both, right?
Yeah, both.
Didn't want to add anything on that?
I mean, certainly both. And then, we need to point out the fact that class doesn't even necessarily rid us of racial disparities when it comes to health.
No.
One of the most paradoxical findings I've seen is that even when Black people get a college degree, their mortality rates are higher than that of white people often when they drop out of high school. That's tragic. That's not the society I think we want to live in. We should have good health for everybody, regardless of education, but there's something really pernicious about that particular finding. Even now, when we talk about risk of COVID-19, and we talk about those that are elderly being more at risk because of the demographic they're in, when we consider life expectancy for Black Americans, when we consider the comorbidities that have been pointed out, again, it is a pernicious society where one's identity becomes a risk factor, irrespective of even when you do all the right things. And last thing I'll say is that these are political choices. This is not destiny. Inequality and despair is not destiny. We can make different choices, and that is the silver lining, that we can have a more moral, just, and inclusive society.
Well, I've enjoyed, I hope you have, but I have enjoyed this discussion a whole lot. And I want to thank you all, not only for being here tonight, I thank you for that, but I know all of you, and I want to thank you for the years and decades of effort you have made to try to create a fairer and better world, each and every one of you. So thank you all very much. And to our viewers, thank you very much. And we will see you all soon. And now we're going to conclude the evening with some music from Abi the Nomad. Abi the Nomad. Thank you all again.
Thank you.
producer and singer based out of Austin, Texas. And I stand behind Bernie's response to coronavirus because I also believe it's imperative that we receive not only free testing, but also free treatments and eventually the vaccine, as we've seen the financial hardship that the treatment costs have placed upon families. They call me modern trash, I am just a common fad. Wrote myself a letter for the gods, now it's crumpled in a bottle flask. Took a while to start, like an engine in the wintertime. Somehow I move forward, I'm not a broken record, I'll be fine. And I lived a fruitful life, soon I gotta see the bear. Word is looking at me like what's next, I wonder if they care. Me and Alex used to sip the handles in the park bench. Foundations, we turned to a garden, yeah. Said I might not make it to the top. People telling me to stop. What the hell could go wrong? Never had the whole world in my hands. They gon' throw salt on my name. Eat me whole till I'm finished. Till a wall full of faces all calling me God. Welcome to the jungle. It's what happens when you ain't been shit. Yeah. Then I spend a vault full of money. Keep on going till I'm finished. Till I fall for my grace and they calling me flawed. Welcome to the jungle. It's what happens when you still like shit. Now I'm moving with a switchblade. Baby, I ain't bitch made. I don't need a conversation. Let me get paid. You could get a flick in a jiffy. Johnny Quick is my nickname. And I'm gon' make with your chick, leave a dick stain. Oh, yeah, my name, doing big things. Professional asshole begins. I'm in the bed like sponge, starfish in the squid. I'm in the lid like I bought me an apartment and shit. I got the sex and the drugs, good money, oh no. There's no chance for me. Got a scandalous side piece and a Hamptons to dance for me. No family, I'm a Randy Marsh, only stands for me. Yeah. Said I never thought I'd be on top. No one telling me to stop. What the hell could go wrong? Had the whole damn world in my hands. They gon' throw salt on my name, eat me whole till I'm finished. Till a wall full of faces all calling me God. Welcome to the jungle. This what happens when you ain't been shit. Yeah, then I spend a vault full of money. Keep on going till I'm finished. Till I fall for my grace and they calling me flawed. Welcome to the jungle. This what happens when you still ain't shit. Said you still ain't shit. Sometimes I don't know what to say. Yeah. So much you're at a loss for words. Sometimes you tell me I'm alright. Yeah. I barely think that I can curb. And all of my friends have lost their light like cataracts. And I believe that if I change something, I'll end up with what I deserve. There's many, many things that you could do. Yeah, there's many, many places you could be. Yeah, but you're stuck right here, waiting for the world to change your point of view. Cause I've been nothing but notes and strings for so long, for so long. I've heard nothing but my cramps telling me to go so far, so far. Oh, feel it running in my head, to my head, from my toes up to my soul. I've seen nothing but growth and everybody show love, so I show love. Sometimes I don't know if you're playing me. You sound rehearsed and when you talk it's like a play to me. You say something real, don't make that face to me. I said I'm in too deep, it's not a phase. No, my friends have lost their light like cigarettes. And And I believe that if I meant something new, you love me for myself and everything I've been through. Cause there's many, many places you could be. Yeah, there's many, many faces you could see. Yeah, you're stuck right here, waiting for the world to change your point of view. Cause I've been nothing but nonsense strings for so long, so long. I've heard nothing but my grams telling me to go so far, so far. Oh, feel it running in my hands, in my head, from my toes up to my sore heart. I've seen nothing but growth and everybody show love, so I show love. Hello, stranger. Don't be afraid. We've got all the things you need right here. The substance and the space. Hello, mother. Won't you come meet my friends? They're here to stay. And I've got too much time and no defense. And they say, I think you should probably be quiet. Careful, stay away from that game. That'll get you no good at all. At all. And they say, I think you should probably be quiet. Careful, stay away from that. That'll get you no good at all. Hello, hello, strange man. Please don't be shy. Hello, brother. Please take these words from me again. I can't seem to find my friends, and all the friends can see what having all these friends mean. We're